Hello and welcome to another episode as part of our Clinical Radiology application changes for the 2025-2026 radiology application series. So this is going to be solely focused on the interview. My name is Mohammed. I'm one of the Radcast co-founders, so let's get straight into it. This is genuinely straight, hot off the press. These changes were made today, and I wanted to make sure that you were all aware of what's coming for those of you applying to radiology. It genuinely is like breaking news, hot off the press. We've gone through it meticulously, trying to identify any major changes compared to last year, just so you're aware, so you can prep appropriately and obviously smash your application and get your radiology training number. So when it comes to the major interview changes, the big ones are in terms of how you get to interview. So based upon your MSRA, which is a really critical exam, so please don't take it lightly, 850 of you, the top 850 of you, will then get to the portfolio verification stage. Basically, here you'll be allowed to upload your evidence saying, I got category A in commitment specialty, category B in audits, etc., etc. Based upon the score you give yourself, the top 700 of you will then be invited to the interview. So basically, 150 of you will not even make it to interview despite meeting the MSRA cutoff. That shows to you, number one, how critical the MSRA is. And like I said in the previous video, all about portfolio, how super important it is that you get as many points as possible in your portfolio. You still have time. It's important that you get as many of those high yield, low hanging fruit points, audits, taster weeks, courses, conferences, doing a case report if you wanted to, just to try and give yourself a competitive edge over your other colleagues who are also applying with you. This year, there's going to be two 15-minute stations. Previously, it was 10 minutes. So we'll go through the actual stations one by one, because it's important that you realize there's actually been quite big changes to Station A in particular. Now, in terms of appointability, you have to reach a minimum cutoff score. It's 22 in each station, Station A and Station B, and a score of 48 overall. Let's say you get 21 in Station A, and then you make up in Station B by doing an exemplary performance. Because you got 21 in Station A, unfortunately, you've not met the appointability cutoff, and therefore you will be deemed unsuccessful interview. Yes, it's cutthroat, but that's how competitive it's become. And let's say you get a minimum score overall of 47. Unfortunately, it's not good enough, and therefore you'll be deemed unsuccessful. Not that you will get a rank, you will not even get to the ranking stage, because you have been deemed unappointable because of your score not meeting the minimum cutoff. For the first time this year, they've introduced a cutoff date for those of you on the reserve list. It does happen. People do get on the reserve list, and slowly over time they get called up to interview, but it's very uncertain. You're often feeling like you're in limbo because you're not sure how long to wait. How does it work when you're waiting? This year they've given you a cutoff. By Monday the 16th of February 2026, you will know if you're coming to interview from the reserve list. If you hear nothing by then, unfortunately, it means you are not being called up to interview, but it gives you clarity in the sense that you can then start to prepare on how to improve your application for the next application cycle. If you're going to take an alternative offer, if you're going to take another path entirely, but it gives you that clarity and that knowledge that it's by the 16th of February, I'm going to hear something or I'm not. Now, let's get into Station A. So, like I said, they're now 15 minutes long. The first part of this 15 minutes is 10 minutes will be spent by an assessor looking through your portfolio to verify your score. So before you even start Station A, 10 minutes are spent by the assessor looking through your portfolio and being like, okay, this candidate, let's say it's me, Mohammed, has given himself category A in commitment specialty. I agree. Oh, he's given himself category A in leadership. I disagree. I need to clarify on this. Then you'll start the station, and now you have 15 minutes, 2 of which can be based upon your portfolio. So for example, they'll say you've given yourself category A in commitment specialty. Can you please elaborate on why you've given this mark? or I have 2 taster weeks. One was in a diagnostic element, the second was in interventional. They were 3 days long. Okay. Or they may ask you, you've given yourself category B in the teaching section, but how have you achieved that? Because we think this is not a national teaching program. We think this is a regional teaching program. Therefore, please justify why it was national. So this is an opportunity for you, number one, to kind of provide a counter argument if there is a bit of uncertainty about your score, that, for example, there's a discrepancy between the score you've given versus what the assessor wants to give you, which they'll identify in the first 10 minutes. Or number two is for you to showcase why you've given yourself a certain category based upon the evidence you have given that the assessor agrees with, but they just want to hear more from it, about it from your mouth. So basically, get ready for 2 questions based upon your portfolio. Number one, link to any areas where there's a discrepancy between the mark you've given versus the mark they think you deserve. And number two, where you have given yourself a mark, the assessor agrees, but they want to just hear why you gave yourself that mark and the evidence to kind of showcase your portfolio achievements. You'll then get a question on understanding of the specialty. This is new. It's new for this year, but it's actually, if you look back historically, if you go back to like 2016, 2017, 2018, this was like a very common part of the interview. When we say understanding of the specialty, we're talking about, okay, you say you want to be a radiologist. It's a 5-year training program, 6 years if you want to do IR. Do you even know what you're getting yourself in store for? Do you know about the exams? Do you know about the training pathway? Do you know about the e-portfolio, the RISA e-portfolio? Do you understand how to subspecialize in IR if you wanted to? What are the common issues facing radiology? Skills mix, workforce crisis, artificial intelligence. So get ready for those type of questions where they kind of really grill you on your knowledge of the specialty to kind of cement why you want to do the specialty, because they're testing your commitment to radiology through this question. And then skills question. Now, this gets people a bit panicked. What does it mean by skill? All right. And we've kind of scratched our heads, thought about it. And it was mentioned in previous application cycles, this skills-based question. And we think it could mean one of 3 things. We think it could mean totally different, but we're going to hedge our bets. The first is relating to the person specification, the thing that you don't read, but you definitely should read. Okay, make sure you've read the person specification for radiology for this year. Don't read an outdated one, that's just silly. In that person specification, it will tell you everything they're looking for from a characteristic perspective and a quality perspective. Candidates must show good communication skills, leadership skills, time management, ability to work under pressure, etc., etc. And they want to ask a question that makes you highlight this skill that you should have, that they're looking for in an ideal radiology candidate. Okay. The other thing it could mean is that they're testing a radiology skill that showcases your commitment and your enthusiasm to develop your radiology skills. It could be image interpretation that hasn't been done for several years. They could bring it back. They had issues with this in the past, notably because those who were more senior, for example, in orthopedic reg, would kind of like really just go to town on a x-ray of the limb compared to an F2. So we're not thinking that that will come back, but it could be other things like critiquing a report. What are the good things about the report? What are the bad things? All of this we kind of covered in our clinical radiology application and interview course, which you can check out on our website. But it's just things to get ready for, okay? Specifically, this is just what the person specification looks like when it comes to for radiology. We haven't showcased all of it because we want you to go away and read it, but this is the front of it, the right at the top. It basically tells you all the criteria that they're looking for in an ideal candidate, the qualities, the characteristics, who's eligible, who's not eligible. If you read it, you'll realize, wait a minute, I need to have an example of me showing good time management skills. And that's something you then go away and prep as part of your interview preparation. Because if they ask you and you don't have an example ready, you're going to feel really pressured and you're going to feel really stressed, really tense, because it's already a high adrenaline situation and you just made it worse by not having examples ready. Station B, once again, 15 minutes. This is a bit more familiar to us in terms of really being similar to the format for the last 2 years now. So there'll be a clinical scenario prioritization where you'll get either a clinical scenario where you may get a trauma report with critical findings and you have to prioritize often with the 8E method, or you may get a series of imaging requests and they want you to prioritize based upon the clinical urgency and radiological relevancy of the scans. Once again, we've covered all of this in our clinical radiology application interview course. Make sure you check it out when you're getting ready to smash your interview prep. Other questions include coping with pressure and managing uncertainty. They've liked to ask this in the format of an ethical scenario. For example, on the website, it kind of mentions one that they may have used previously where a surgical registrar disagrees with your report. How would you deal with it? That's like coping with pressure and uncertainty. And then team involvement, once again, asking you openly, give me an example of when you've worked in a team and you showcasing your example, what skills you've learned, and why it's important for a radiologist to have such skills. And if you want the TLDR, 2 times 15-minute stations, not 2 times 10 anymore, a revamped Station A, this is the big one. Questions relating to your portfolio that will have been reviewed up to 10 minutes by an assessor before your station starts. They may identify areas where they think you deserve a different mark compared to what you've given you, or they want to kind of just get the evidence from you in terms of an answer to kind of justify why you've given the mark you have, which they may agree with. Skills-based question that could relate to the person specification, for example, any characteristics or qualities that they're looking for. It could relate to image interpretation or you critiquing a report, and understanding of the specialty. This is like bread and butter kind of stuff. Okay, what's the biggest issue facing radiology? Can you walk us through the training program for radiology, etc.? Station B is very similar to previous years. There'll be a clinical prioritization question, an ethical scenario based questions, and then a question relating to your team involvement skills and showcasing how you've developed those skills as a clinical professional. So why should you bother with interview prep? I don't think there's any confusion here. At the end of the day, it's worth 70% of your final rank. It used to be 60%, so that's gone up. Portfolio is now 30% of your final rank. Okay, it used to be 40. So you can see the interview is slowly creeping up in terms of its importance. MSRA is just used to get you to the point of being eligible to submit your portfolio evidence. But the big chunk, 70% of your final rank, is going to come from your interview performance. And with the changes to Station A, you really can't sleep on this. So once again, it's a big change like they did with the portfolio, which I thought was a very positive change. When it comes to interview, Station A is going to be the curveball this year. You've got to make sure that you get every single point possible, not only in your portfolio, but also in your interview. And every point, remember, this is critical. There's a reason why I keep reinforcing this. Every point is one step closer to getting that crucial, lucrative training number as a clinical radiology registrar or resident. And of course, Radcast, we've always got your back. And if you need any personalized interview support, just get in touch, hello@radcast.co.uk. We will then go through your application, highlight any portfolio areas that you could improve upon, but also start to give you guidance and support and resources on how to really build your interview performance. Notably when it comes to Station A, whether it be the skills-based question, whether it comes to your understanding of the specialty, how to prioritize clinical scenarios, basically the whole package, we've got you covered at Radcast. So that's another webinar done, another module done on the new application changes. Please get in touch at hello@radcast.co.uk if you've got any questions or just want some personalized support. And if there's any further changes to the application, you can bet your bottom dollar we'll make a new video about that so you can get up to speed and smash your application this year. Take care, everyone.